wplasty is a scar revision technique that's utilized to camouflage scars that are not parallel to relaxed skin tension lines. We use a geometric broken line closure when we have hypertrophic scars that are parallel to the relaxed skin tension lines. So here in this example, we're using a wplasty, and again, the peaks and valleys are such that the peak on one side corresponds to the valley on the opposite side. The limbs of these wplasty should not be any greater than 5 to 7 millimeters in length. The angles you can see are not less than 90 degrees. They're broader than 90 degrees usually, or at least 90 degrees. Now we're dissecting the wplasty by now elevating the skin that's going to be removed, which would be the site of the scar. This is a little bit broader than we would use in the human because of the thickness and toughness of the pig skin. Undermining continues, actually, to remove the scar. And again, wplasty is used to camouflage a scar not parallel to relaxed skin tension lines. Now the scar has been removed. You can see the area of the scar, and now the tissues are well undermined. Again, either a 15 blade or a dissection scissors may be used with the tips pointed upward so that you don't interfere with the underlying vasculature and then have to obtain hemostasis. Now, finger pressure is used to make sure that it can be closed easily. Deep sutures may be placed when necessary, and it's usually best to use deep sutures with a long-lasting life so that they are in position for a long time. Then eventually they may dissolve. This will allow the deeper tissues to be closed and keep the tension off the skin sutures. Here the sutures are interrupted, again, from a valley to a peak, or from a peak to a valley at the apex. Corner stitches may be used. Here's an example of a corner stitch being used at this site into the dermis to prevent tip necrosis. They are not necessary in every case. And now the second throw is through the skin, and the suture is then tied down to close the wound. Instrument tie certainly may be used, or a hand tie may be used. Always use square knots.